everyone, this is Abdallah Ali from Tanzania. Today I'm going to discuss with you my personal experience and how the government made its measures on the COVID-19 outbreak, starting with my personal experience. Obviously, or during the outbreak, everyone in the country and the worldwide in the world uh, was threatened by this outbreak. So even in Tanzania, the citizens and the staff and what were really threatened by the outbreak. So starting with my personal experiences, like the closure of the universities, that's what had first effect on me, because during the outbreak I was finishing up my last semester at Sengalema Health Training Institute in clinical medicine. So this closure of the universities affected me in different ways, like not finishing a few of my courses, having a limited time to cover up with a semester and prepare myself for finishing up the semester exams. The other thing that was really bad to me, it was online classes. I really hate online classes because in Tanzania we have these internet problems and what so, and even getting these internet bundles is quite difficult here. So all these online classes were miserable. We were not attending as it was planned, as it was scheduled, because of the internet problems and things like that. So that was one. Second one, I got uh, these difficulties basing on my family. We had this family income uh, decrease in our family income. So my family, especially my father, depends on the business of transporting some goods from Tanzania to the neighboring countries. So the closure of the country's boundaries made the fall of the family income. So it was very difficulty, and everyone was saying like, okay, how are we going to live? How are we going to do this and this? Yeah, but thank God it just extended for some few months, and now all is well. Every business is there, so all is good now. Okay, I'll because of time I would like to jump on the government measures. What government measures took on the outbreak, concerning the outbreak. First thing that the government did is uh, letting know, or provision of this education concerning COVID-19 outbreak, including the symptoms of the COVID-19, including what does it mean. So the symptoms, the preventions, uh, and all kind of prevention and control measures that people can be undertaking can be undertaking to ensure that everyone is safe and prevent themselves from getting these uh, COVID-19. The second thing that the government did was the closure of schools and universities. I mean the closure of countries' boundaries. That's the second one. They did close the country boundaries, so that there is no the increase of number of cases in Tanzania from the outside, and starting maintaining and performing rapid screening of the people within the country. So they did close the country's boundaries, and I instructed all the boundaries to be screening for the people who are traveling. Yeah, so the third thing that they did is they did keep this instruction of quarantine for 14 days, especially for travelers who are from the countries who had many cases of COVID-19. So the travelers were instructed to stay at the quarantine for 14 days. Yeah, so for 14 days they were kept for quarantine, and it was all managed by the government, and everything was fine. people from there, a lot of Tanzanians were in different places outside, outside the country. So when they wanted to come back at their homeland, they were instructed to stay in the quarantine for 14 days, and it was well managed by the government. The other thing which was done was launching safety and preparedness measures to protect the staff, the hospital staffs, the clinicians, and all the hospital staffs concerning mainly meeting these COVID-19 patients. So they did a rapid screening of the patients who are attending at the hospital, also isolation to the uh, all the patients that were having symptoms of COVID-19 and who had been confirmed to have COVID-19. They are sent to the special places to be kept there and get treatment and other things like that. Also, there was provision of these protective gears to the first line workers who are the hospital staffs, and including masks, which helped to do protect themselves from getting the COVID-19. Also, the other thing that the government did was a training of hospital staffs, medical staffs. So the government trained the medical staffs on how to handle this COVID-19, on symptoms, on prevention, and on control of the whole disease. So that the outbreak the outbreak can be limited to the not to spread to the other uh, people who have been not yet being affected. So that the other thing that they did there are some seminars on the medical staffs. The other thing that they did is closure of schools and universities approximately for 2 months, and then resumes with all the measures like hand washing, wearing protective gears like mask in the class, and other things that they did. Also, there was an emphasis on prayers, as you know, in Tanzania, a large percent, a high percent of the of Tanzanians believe in God. They have these uh, religious beliefs. So, as the president instructed, made an emphasis on the religious leaders on making prayers to the because it's what people believe. So they make prayers to the in order to decrease or to protect themselves from getting these COVID-19. Also, he made an emphasis on these herbal doctors, the doctors using herbal medications to see if they can do on relieving the symptoms or preventing uh, people from getting these COVID-19. And as the government or the president claims that this helped so much till now. So the other thing is they did a screening, rapid screening of the of people, especially at the airport and these public transportation centers. They did disinfection of the airports on public transportations like buses and and hotels. They also did that. But I have few positive effects that I would like to share with you today. Is one, the knowledge about COVID-19 outbreak. I'm really excited that I didn't study well on the outbreak. So now I have the knowledge of how a outbreak can be prevented and controlled. That's the positive effect. The other one is it reminded the government and the government and the whole world that they should construct a better health system so that any outbreak like this can, if occurs, they can combat or they can control the situation as early as possible or without being a big problem to their people. So thank you. That was my experience today. Thank you very much. Welcome to Tanzania. Welcome. You're warmly welcome.